Mosinee as well, and he had a story to tell about healthcare. Unfortunately, he hasn't lived up to what he said. It is an all too common reality during his presidency. And with that, I want to be quiet myself and turn it over to our distinguished panel. We are going to hear from a number of folks, and then we will have a few minutes for questions at the end. But at this point, I'd like to turn it over to Senator Baldwin. Thanks so much for joining us today, Senator.
Thank you so much, Joe. I am really glad to have the opportunity to join you today to talk about the most important issue on the minds of Wisconsinites, healthcare. Right now, we are 7 months into a global pandemic, and Donald Trump has failed to protect America. As we know now, Trump knew that this pandemic was deadly, and he refused to take decisive action early on to control the virus, and he still has no plan as of today. He has refused to lead and insists that the virus will just go away. And I heard those words come out of his mouth in recent days still. In April, Vice President Mike Pence declared that the US would have this coronavirus epidemic behind us by Memorial Day weekend. The person who President Trump put in charge of our medical supply chain, his son-in-law, Jared Kushner, he predicted in April that by June we would be back to normal and that in July we would be rocking again. It's September and the pandemic is not over and we are not rocking again. Wisconsin this past Sunday set a new one-day record daily record for new COVID-19 cases. So things are continuing to get worse for Wisconsin and across the country. While our nation fights an unprecedented healthcare crisis, President Trump continues his work over the past 4 years to sabotage our healthcare system and make it harder for people to get the healthcare that they want and the healthcare that they need. Since President Trump took office, more and more Americans are going without health insurance every year. More than 6 million Americans have lost their employer-sponsored health care because of the pandemic and associated economic impact. We need to be making it easier, not harder, to get health care. And people need health care at a price they can afford. I introduced legislation to support millions of Americans who have lost their health insurance due to a job loss this year, and invest in enrollment outreach and assistance to help more people find the quality and affordable health care that they need. But instead of working on solutions, President Trump has doubled down on his support for the lawsuit in federal court that would absolutely eliminate the Affordable Care Act completely, including its protections for millions of people who have pre-existing health conditions. If you're waiting for President Trump to release his healthcare plan, he doesn't have one. He doesn't have one. Trump's failure to confront this deadly pandemic has led to job loss, lives lost, and we cannot allow this to become the new normal. We have to remember that this November, perhaps more than ever before, healthcare is on the ballot. And I will now turn it back to Joe Zepecki, and he can introduce our fellow panelists. Thank you.
Thank you, Senator. Thank you for your leadership in passing the Affordable Care Act and for your work today. We appreciate you. Our next speaker is Wisconsin Attorney General Josh Kaul, who was instrumental in removing Wisconsin from the lawsuit currently pending before the Supreme Court. Attorney General Kaul, take it away.
Great. Well, first, thank you, Joe, and Protect Our Care for organizing this important event. I want to thank Senator Baldwin for her leadership for the Affordable Care Act, Secretary of State joined us and for all of her leadership. Act was implemented. Kristin, I had the opportunity to hear your comments at the Democratic Convention, and they were incredibly powerful. And Dr. Huebner, thank you for joining us as well. I want to just talk briefly about two issues, the Affordable Care Act and President Trump's response to the coronavirus pandemic. And just to follow up on the point that Senator Baldwin made, there is one through line that applies to both of those, and that is that Donald Trump has no plan whatsoever for protecting the health of the American people. We are now almost 4 years into his presidency, and he has attacked the Affordable Care Act and promised a plan over and over and over again. And all we have seen with respect to the Affordable Care Act is attempts to undermine it. He's put out rules that allow for junk plans to be used rather than the requirements that had been put there through the Affordable Care Act. And his administration is going to be arguing to the Supreme Court 1 week after the election that the Affordable Care Act should be invalidated. We have withdrawn Wisconsin from that lawsuit, as Joe said, and in fact, we've joined other states in arguing that the Affordable Care Act needs to be left in place. And the reason that is so important is the health insurance coverage for tens of millions of Americans is at stake. If the ACA is repealed, tens of millions of Americans will lose access to affordable health insurance coverage. People would also lose protections for pre-existing conditions. The president says he wants to protect them, but his actions show otherwise. He is trying to take those protections away from the American people. Young adults would also lose the guarantee that they can remain on their parents' coverage until they turn 26. We need a president who is going to fight to protect people's health care and work to expand access to affordable health insurance coverage. And I'll note, we need to do that here in Wisconsin as well by expanding Medicaid, not going the other direction as the president has been trying to take us into. And with respect to the coronavirus pandemic, there is still no plan at the national level for how we address this pandemic. The plan is to hope for the best, but to undermine governors and other leaders in states who are working hard to fight this virus. We need national leadership. We need a national plan for testing. We need a national plan for isolating cases. And we need a national plan for getting a vaccine that has gone through the appropriate scientific processes so that people across the country will know they can trust it and use it, so that when that vaccine comes out, we can get it to as many people in the country as possible. What we've seen from the president is deception. We've now all heard what he said to Bob Woodward very early in this pandemic. And what he was saying to all of us was very different from what he was saying to Bob Woodward behind closed doors. This pandemic has now taken the lives of almost 200,000 Americans, and we need a president who's going to respond to it like the crisis it is. We need a president who's going to work with the states to fight this pandemic rather than trying to undermine their efforts. And we need a president who is going to fight to protect the health of the American people. So we need new leadership. Thank you so much for having us discuss these important issues. And as I said, it's a pleasure to be joined by these other panelists.
Thank you, Attorney General. With that, I'm going to turn it over next to former Health and Human Services Secretary Kathleen Sebelius, who's also the governor of Kansas, and did a great job during the Obama administration. Madam Secretary, take it away.
Well, thanks so much, Joe. And it's great to be with my friend, Senator Tammy Baldwin, with General Kaul, and I look forward to hearing from the other distinguished Wisconsin panelists. It is almost mind-boggling when you think about a president who has done more than anybody could have possibly thought of to try and take healthcare away from people. And he ends up being the leader and the commander-in-chief during the worst health crisis that any of us have ever faced in this country. The Affordable Care Act had its 10th birthday in March. I don't know if you all celebrated, but I certainly did. And 20 million plus Americans now have affordable health care thanks to the law that President Obama signed in 2010 and that Senator Baldwin helped to put in place. General Kaul outlines some of the benefits, protects people with pre-existing conditions, offers an opportunity to have some help if you're purchasing your own health care, has an ability. We got rid of gender discrimination, so women no longer paid 2 and 3 times what their male colleagues and friends paid. What we saw over the years is the lowest rate of uninsured Americans, the lowest rate of uninsured children, and the lowest overall health cost inflation that has ever been recorded in this country. So it works. We know from measurements at the end of 2016 that it works. We've had an administration who has been relentless about taking away people's health care. Remember that in the first 2 years of the Trump administration, as they say, they owned all the real estate. Republicans controlled the House, they controlled the Senate, and they controlled the presidency. So the fact that Donald Trump did not deliver on his promise to repeal the ACA day one is all about the fact that he couldn't even convince people in his own party to do that work. They've never had a replacement plan. The day President Obama signed this bill into law, he was sued by attorneys general. That case was decided in 2012. That didn't stop the relentless fights. Repeal efforts continued. But the Republicans in 10 years have never had a replacement plan, still have no replacement plan, and still are lying about the fact that they do believe in protecting people with pre-existing conditions, that they will actually support efforts. Thanks to Protect Our Care, who mobilized efforts across this country, mobilized efforts among legislators, put together town halls, made sure that the public spoke out, we still have an Affordable Care Act. Thanks to the voters who came out in 2018 and said, you're not going to take away my health care. We now have a House majority that is strong in support of expanding healthcare, not retracting healthcare. And I think there could not be a more important issue on the ballot in 2020 than healthcare. In the middle of a pandemic, as General Kaul said, this administration is doing a totally unprecedented thing, going to the Supreme Court. Instead of defending a 10-year-old law, they are suggesting that the entire law be struck down. Get rid of it all, including protecting people with pre-existing conditions. Don't let anybody fool you about that. They do not have a plan to protect anybody with pre-existing conditions. So we have a pandemic. Millions more people have lost their health insurance. Thank you, Senator Baldwin, for your legislation, because one of the things this administration did is get rid of all the outreach and enrollment people. They have been totally silent on the fact that if you lose your job during this pandemic, you are entitled to immediate enrollment in a marketplace plan, or in a state with Medicaid, you're entitled to enrolling in that. They haven't told anybody that. They aren't helping anybody with that. So there could not be a more urgent need in the COVID crisis than to get new leadership and make sure that we indeed do protect our care. I'm delighted to join you in Wisconsin today and look forward to this battle over the next 50 days. Our health and our livelihoods are on the ballot in a way that has never been as urgent as it is now. And I look forward to new leadership and making sure that we can strengthen and expand the Affordable Care Act, not eliminate it.
Thank you so much, Secretary Sebelius. I think that one of the main takeaways from your points is that when it comes to healthcare, President Trump and Republicans especially, it's all just words. And there's a reality that Americans are living based on their failures. And to speak to that directly in the most devastating of ways is our friend Kristin Urquiza, who is the founder of Marked by COVID. Kristin, thank you so much for joining us, and we are so sorry, first and foremost, for your loss. With that, we'll turn it over to you. Thank you for joining us.
Thanks for having me, Joe, and Protect Our Care. And it's thank you to all of the other panelists on the phone for your leadership on this incredibly important issue. As Joe mentioned, I'm the co-founder of Marked by COVID. I've also been advising Protect Our Care over the course of the last month. What brings me into this space is because my dad, Mark Urquiza, died from COVID-19 on June 30th. He was otherwise a healthy 65-year-old man who had just recently gotten a clean bill of health that he was proud to share and boast about to his brothers and sisters, and of course to me. And he was looking forward to retiring soon after having a long career in the manufacturing industry. My dad loved his community. He had faith. He had a huge amount of friends and a long life ahead of him. To give you an example, my grandparents lived into their 90s. So he did not consider himself old by any stretch of the imagination. And neither would anyone here have considered him old if you had seen him on the karaoke dance floor singing his favorite song, A Hard Day's Night by the Beatles. My dad was a Trump person. He believed in him, he voted in him. And whenever the president in May, along with governors across the country, Republican governors, said it was safe, that we were on the other side of the pandemic, and that if you didn't have an underlying health condition, that you could go out and start to resume normal activities. And despite my efforts to try to keep him safe, to show him data, to show him comparisons to other countries, I could not compete with the megaphone of lies and misinformation coming from the White House. My dad ended up contracting the virus, and he paid the ultimate price with his life. Since then, I have been working underneath the brand marked by COVID as a campaign to bring people together, to help uplift their stories, and to call on a coordinated, data-driven national response to this pandemic. It's the only way that we are going to make it out alive. And the course of the next several weeks are some of the most important of our lives to ensure that we are putting public health, the health of our families, our communities, our parents first, over political aspirations. And what I have seen from the Trump administration over the course of the last 4 years, but in particular since this pandemic hit us, was that it's all been for his own political prospects, his own image, and for the stock market. He does not care about people like my dad and so many other folks just like us who have been impacted or lost loved ones. So that's why I am excited to be partnering with Protect Our Care to really drive home the point that nothing could be more important than new leadership to ensure that not only is the ACA protected and expanded upon, but we're putting the lives and livelihoods of regular people first and foremost to ensure that we have the best chance of eradicating the virus and getting back to normal. Thank you.
Thank you so much, Kristin. You are setting such a powerful example, and our hearts go out to you. Thank you. Someone else who can speak to really the direct impact that this is having when it's not about the rhetoric and it's about the reality is Dr. Jeff Huebner, who is a family physician here in Wisconsin, in the Madison area. Dr. Huebner, take it away.
Thanks so much for inviting me, and thanks to Senator Baldwin, Attorney General Kaul, and Secretary Sebelius for your leadership on healthcare. And I'm, of course, really humbled to speak after Kristin, hearing from the patient experience. I'm so sorry for the loss of your father. And I'm proud and glad that you're sharing your story and working with other grieving families. So hopefully we can prevent more unnecessary deaths. I'd really like to highlight a few of the themes raised here today. Based on my perspective as a family doctor, I take care of patients and families ranging from birth to 100. In my own panel of patients now, I've helped provide follow-up care to several positive cases. Fortunately, all of those have recovered, but as we know, cases have recently spiked here in Wisconsin, and we know an incredibly high number of patients are dying every day in this country. Over 1,200 now in Wisconsin and over 195,000 in this country. Disproportionately, of course, affecting communities of color. So make no mistake, this is clearly deadlier than the flu, as the president recently acknowledged in released tapes. The death toll is already several times higher than the annual flu season. And there's also been a misconception that young people are invincible to COVID. Clearly, the recent spikes of cases on university campuses throughout the country and here in Wisconsin should raise alarms. Many of those cases are asymptomatic, but they pose a significant risk for spreading the disease in the community to those who are vulnerable, And meanwhile, a recent report this week from the Journal of the American Medical Association reported that of young adults who are hospitalized with COVID, 10% required ventilators and 2.7% of them died. And amongst the spike of university cases here in Madison, we learned of the first one to be hospitalized yesterday. So we really need to do everything we can to prevent additional cases. I worry every day about my own patients. I worry about my family, especially as we enter this flu season. The pandemic's effects on our society have been massive. My pediatric patients are missing out on being able to go to school, and my geriatric patients are facing assisted living or nursing home or hospital stays, sometimes at the end of life, without being able to have the comfort and help of their families and friends. And as a country, we're stuck in neutral. We're not taking an evidence-based national strategy or mobilization that we need to suppress the virus. It doesn't have to be this way. Many other countries have shown that if you follow the science, we can do this. So we continue to suffer from joblessness and the agonizing decisions to keep kids home from schools. And all of the incompetence from the top has intentionally undermined the public health and research scientists, so many of my colleagues who are fighting COVID. Dr. Fauci, the CDC, the FDA, our local public health departments have all been shamefully undermined in their attempts to help the country understand and unify to do what's needed to suppress the virus and get back to some semblance of normalcy while we're awaiting a vaccine. Wearing a mask in public should not be controversial. It's cheap, it's easy, and the evidence shows it protects ourselves and others around us. But instead, we have a president who's derelict in his duty and example, and a state legislature here in Wisconsin that seems to care more about politics than saving lives. I have to tell you that doctors and nurses are weary right now. We're even more weary, though, from the lack of national leadership, the continued anxiety we have about PPE, the disregard for following science and doing what we know will work. My colleagues and I have all dedicated our lives to taking care of people in situations like a pandemic, but I would have never imagined that our country could not muster the resources and the will to provide what we need to do. In this case, it's making sure we have PPE, making sure we have adequate testing and contact tracing, and doing what we need to suppress the virus while we build that vaccine. So I want to reiterate the importance of voting this fall, because voting is one of the best ways you can assure your health and the health of your family. We're all clearly voting for our lives. So let me just mention a few of those quick ways we need to vote for health. One, vote for the candidates who are going to follow the science, who respect and work with medical and public health professionals, who will stop slashing health agencies' budgets and do what we need to do to open up businesses and schools again. Vote for the candidates and leaders that will preserve Medicare and allow it to negotiate with drug companies to bring drug prices down. Too many of my seniors have to decline the optimal medication, whether it's a blood thinner, an inhaler, or insulin, due to the high prices. And vote for the candidates who will preserve and build upon the Affordable Care Act to make sure that all Americans and hardworking families have access to the care they need when they need it, regardless of whether they have pre-existing conditions. Imagine coming down with COVID or any other serious illness without the security of health insurance. And finally, vote for the candidates who will tackle racism as a public health issue. Not only is COVID disproportionately striking and killing people from communities of color more often, but the pandemic has greatly exposed many of the other disparities in health faced by communities of color. It's incumbent upon us as doctors and health professionals, our health systems, businesses, and elected leaders to work together to end these disparities. I just want to wrap by asking everyone to stay safe, do what you know works, physically distance, keep washing your hands, mask up when you go out, and get your flu shot like I did yesterday. Thank you so much, everyone.
Thank you so much, Doctor. Very well said, and we certainly appreciate it. We're going to switch to the second part of this. I know we have some journalists on, and we have some viewers who have entered questions into the live stream. Before we switch gears all the way, though, I know Senator Baldwin has to get to another meeting. So, Senator, I wanted to give you an opportunity if you have any other reactions to the other speakers or wanted to offer a word in closing before you have to go.
I do want to just say a couple of words. First of all, thank you to you, Joe, and Protect Our Care. This is such an important conversation to have at any time, but particularly before an election. I also wanted to share my condolences with Kristin. I too watched you at the Democratic National Convention, and it was one of the most compelling moments in that entire week. And we thank you for being willing to turn your tragedy into hope for others. Secretary Sebelius, it's always great to see you and recall that work we did together when you were secretary and I was in the House, and trying to navigate through the Affordable Care Act. But your points about helping people enroll and how that is yet another way in which this president has sabotaged the Affordable Care Act, among so many others. General Kaul, thank you for your leadership. The legislature tried to make it very difficult for you to get out of the lawsuit endeavoring to overturn the Affordable Care Act, but you provided that leadership and got the job done. And I really, really appreciate your advocacy for broadening healthcare coverage for all Wisconsinites and protecting the incredible protections within the Affordable Care Act that keep people with coverage regardless of a pre-existing health condition and address so many other inequities. Thank you all for your leadership. And I want to end with just echoing Dr. Hübner's final words. Vote and follow the scientific advice on keeping safe and healthy. Thank you all.
Thank you, Senator. I'm going to actually turn it over to my colleague, Kelly, with Protect Our Care, who is going to walk us through how the Q&A is going to work. Kelly, take it away.
Thanks, Joe, and thank you to everyone who has joined us this morning, and a big thank you to all of our panelists. At this time, I would like to invite everyone to submit questions. If you have a question that you would like to ask of our panelists and you are joining us on Zoom, please go ahead and enter that question into the chat box and we will field it. If you are joining us on Facebook Live, you can leave a question in the comments on the video, and we will make sure we get to those as well. We actually have one question coming in for Attorney General Kaul. This question asks, how would the Trump administration's lawsuit to eliminate the Affordable Care Act affect Wisconsinites with pre-existing conditions?
It would end the protections that were passed in the Affordable Care Act for people with a pre-existing condition. And that would mean that we would go back to the situation we were in before the Affordable Care Act was passed, where health insurance companies can refuse to provide coverage to people based on a pre-existing condition, where people could be charged differently based on their gender, based on having a condition. And by the way, COVID-19 could be a pre-existing condition if those protections are eliminated. So that would mean that anybody who has been impacted directly by this pandemic would have significantly more trouble getting health insurance coverage. Now, if that were to happen, the federal government, state government could step up and pass legislation that could provide those protections. But it has been years and years since the Affordable Care Act was passed, and there has been no effort, no plan that we have seen. And given that, we need to fight this lawsuit tooth and nail so we can protect people's coverage if they have pre-existing conditions.
And Joe, if I could, I think in addition to what General Kaul has said, the Medicaid expansion, which has taken place in states across the country, unfortunately still not in Wisconsin or in Kansas, where I live, would be eliminated along with the entire Affordable Care Act. So people in all kinds of states would automatically lose their health coverage, and those who purchase coverage on their own would lose the opportunity to have the federal government pay a share of that coverage through a tax credit. So we'd be back in the situation where farm families and veterans and individuals who are running mom and pop stores or gig workers would suddenly be entirely on their own trying to find health insurance if they could ever afford it and be able to get through what was the individual health screening that insurance companies could do legally, looking at your health situation and say, either I won't sell you coverage at all, or I will eliminate all the conditions that you have that might be costly and sell you coverage for everything else. So those days have been gone for a decade, and it would be a real tragedy for over 20 million people to return to that system without those kind of consumer protections.
Thank you. Thank you so much for answering that question. We have a question from Bill Glauber at the Milwaukee Journal Sentinel. This question is for Kristin. Kristin, the question asks, at recent rallies for President Trump, many attendees have not worn masks. How do you react to that, and what is your advice to those supporters?
My goodness, this question. I thank you for asking it. I am so overwhelmed with the fact that the president continues to not only endanger the lives of us generally, but his own supporters. It just brings home the point that he cares about himself and his own interests, first and foremost. Sadly, people who can come together, who don't practice social distancing, who don't wear masks, and in particular are indoors, are going to spread the virus, and people will pass away from that. It is unacceptable for the president to be doing this. And so my message for those out there who still don't believe it's true and don't believe in the science, I'm not sure there's anything that any one of us can say to actually be able to convince them to do something different. But I'm hopeful that they will listen to wearing a mask is simply the most patriotic thing that any one of us can be doing at this moment.
Thank you, Kristin. I don't know if anyone else on the panel wants to respond to that question either. But if anyone else on the line has questions, I would invite you to go ahead and pop those into the chat at this time.
Yeah, just while they're doing that, I mean, Kristin hit all the points beautifully. Like, I mean, for me as a physician, it's absolutely infuriating to see President Trump knowingly putting people's lives at risk. I don't really get how anybody can or should get away with that. And I hope we will hold him accountable in the election. My advice to those supporters is to follow the public health and scientific guidance. Don't go to large gatherings that are indoors. Stay physically distanced and wear a mask.
Thank you so much. We do have one more question coming in from WSAW. The question asks, the Trump campaign has put a large focus on the central Wisconsin region and the state in general, with numerous visits to the central rural regions of the state where much of his supporters are. Why should people in north central Wisconsin and rural areas believe that Trump does not have their best interest and the Biden campaign does?
So if I could just jump in quick on that, I want to try to take the politics of the regions of the state out of this. You know, we're here to talk about the Affordable Care Act and the dangerous health crisis facing this country. But I do think there is a very good question within there, which is we have a lot of Wisconsinites living in the outside of the major urban centers of Madison and Milwaukee and even, you know, Green Bays and Wausau's. If you are in a rural community, how should people who live in those types of communities think about this virus? What should they be doing to protect themselves? And should they be doing anything any differently? I'd love to hear from either Secretary Sebelius or Dr. Huebner specifically on whether folks in those types of communities should be doing anything any differently than the rest of us should.
Dr. Huebner, why don't you start?
Sure. Yeah, I mean, I would just say to my neighbors and friends in all parts of the state, first of all, I mean, talk with your doctor if you have any questions or concerns. I'm very confident that my colleagues all understand the science and will give you great advice. And I also believe that, you know, some patients, some people, understandably, they want to and they need to seek out that information from sources that they trust, and physicians and public health professionals are great sources of information. So I think, to your question, Joe, too, within there, everyone throughout the state and throughout our country needs to follow the same public health guidance, which we've talked about quite a bit during this discussion. The virus knows no boundaries, it doesn't care where you live, and we all need to follow that public health guidance.
Well, I would just also say Dr. Hiedmer started his or finished his earlier comments with the notion that he got a flu shot yesterday. One of the things that the public health officials told all of us is that what we really don't want to see this fall is the virus swirling on top of a difficult flu season. So flu shots are available. Hopefully that is, again, a patriotic act. People can step up and get a flu shot because that will minimize the risk of being susceptible to both of these. I was fortunate to work for an administration where the president said, in spite of not really knowing all the answers when H1N1 hit in 2009, that he would defer to scientists. He would listen to the science. He did not want the political officials to interfere with the science. And that, I think, is an important message for all of us. So doctors, healthcare providers, medical researchers, people who have evidence, I think it's just important not to make this a political debate, because it isn't a political debate. It is about keeping people safe and healthy. And what we know is that even folks who show no symptoms of this dangerous virus can carry the virus. Even children who show no symptoms can bring the virus home. So listening to public officials who are looking out for the health and well-being, and it's different in different parts of the country. There are spikes now in Wisconsin and Kansas in the Midwest, and some of the East and West Coast states are in safer conditions. So that is information that people should take seriously. But lives and livelihoods have been lost, way too many right now, for us not to pay very close attention to the science.
And if
Thank
I
you,
could
Secretary. Oh,
follow up on that briefly, I grew up in Oshkosh and Fond du Lac, and I believe the station you mentioned is Wausau. This, as Secretary Sebelius just said, this is an issue that really should not be a political issue. This is an issue that potentially impacts the life of every person, not only in America, but in the world. This is a global pandemic that we are facing. It has had an enormous impact on people's health. It's also had an enormous impact on our economy, which has felt major effects from this virus. What we need is leadership that's going to unify the American people. We've heard the phrase, we're in this together. We are really, really in this together. If any one of us contracts the virus, that impacts the safety of all of us who come into contact with that person. This is a time when we need unity so desperately, and we need a comprehensive national plan to address this pandemic. And unfortunately, the president we have right now is not capable of that. He only knows divide. And so issues that we should be able to all come together on, like wearing a mask, so that we can help protect our own safety, but also protect the safety and lives of others. Those are issues we need unity on, and that means we need leadership from the national level. And so that is something that impacts people no matter whether they are from an urban area, a rural area, whether they are from Wisconsin or Kansas. We need leadership that's going to bring us together and to unite us around following the science so we can save lives, we can help get back to normal, and we can help our economy get back to normal as well.
thank you. And I'll just wrap that one up by pointing out that according to yesterday's briefing and update from the State Department of Health Services. 71 of our 72 counties are seeing high transmission rates right now. No matter where you live in Wisconsin, this is real. I know we have folks who have to get to their next event, but I think we have time for one more question. Kelly, was there another question in the chat or on the live stream?
Yeah, we had a question coming in over Facebook Live about Medicaid expansion under the Affordable Care Act and how states that expanded Medicaid would be affected if the law is eliminated, and how states like Wisconsin, which do not expand Medicaid, could be affected if the ACA is eliminated outright.
Well, I can take that a bit and then let the general also speak to Wisconsin. Striking down the entire Affordable Care Act would mean that the federal government would no longer pay for the vast majority of eligible low-income workers who have been now qualified for Medicaid in states throughout the country. And that would cease to exist. It would frankly blow up almost every state budget because those healthcare costs are extraordinary, and governors in various states in the country would be faced with either coming up with 100% state funding to pay 90% of the costs that are now borne by the federal government, or drop literally millions of people from coverage. In states like Wisconsin and Kansas, we both have elected governors in 2018, where the new governors are committed to expanded Medicaid. In both of our states, that still has not been a successful legislative effort, but I know in our situation, our governor, and I think Governor Evers, is continued to be committed to saying this is a top priority. Again, the opportunity for states like Kansas and Wisconsin would be struck down, because no longer would the federal government be standing by saying, we will provide the lion's share of the funding for these newly insured individuals. I know that Vice President Biden has said what he wants to do is actually qualify the new states for the same kind of 100% funding that was available originally in 2014 and 15 and 16 for states that immediately expanded, which would be hugely helpful in a state like Kansas. It would eliminate one more kind of talking point. So millions of people would lose their current health insurance, and millions more would see the possibility of expanded Medicaid going away if this lawsuit is successful.
I would add, in Wisconsin specifically, we did something really unusual when Governor Walker was in place. Rather than the federal government offered us a lot of money to expand Medicaid and cover a lot of Wisconsinites. But instead we said, we don't want that money. We're going to spend our own state tax dollars and cover a portion of the people we could have covered if we had accepted the federal Medicaid expansion. So if we go ahead with accepting Medicaid expansion, we will cover more Wisconsinites, tens of thousands of additional Wisconsinites, which not only means better health outcomes for those folks, but also opioid epidemic, help us fight the pandemic as people get the health care coverage they need. But we would actually save the state over $100 million a year, because we're now spending state tax dollars to cover a portion of those folks. And we could put that money to all sorts of other good uses. So, there are legitimate philosophical differences on important issues. There are challenging issues that policymakers face. This is not one of them. This is an issue we should all be able to get behind and provide coverage to more Wisconsinites.
Thank you, sir. Thank you all. This was fantastic, and I so appreciate you taking the time to join us. Kristin, Secretary Sebelius, Dr. Huebner, Attorney General Kaul, thank you to Protect Our Care for their support on this. Thank you to our friends at Opportunity Wisconsin and For Future Wisconsin and Planned Parent Advocates of Wisconsin and A Better Wisconsin Together, who have helped promote this event, make sure that people can hear this important conversation about what is at stake. It is a big day in Wisconsin, not just because of this event, not just because President Trump is here, but because about 1 million ballots are being sent to Wisconsinites today. And so if you take one thing away from this, please know that this year, this ballot, healthcare is on the line. Thank you so much to everyone.
Thanks very much.
Bye.
Yeah.
Bye-bye.